Uh, Good morning, everybody. I'd like to thank at first Professor Muhammad Al-Muqdadi and all members of the organizing committee inviting me to do this presentation on pediatric gastroenterology disease related to genetics. In fact, as we know all, there is many aspects of the genetics related to pediatric gastroenterology. And at the level of colon and small intestine, for example, we have more than 6 different diseases. At the level of pancreas, we have 2 diseases. And at the level of liver, we have more than 6 different diseases. Why are we speaking about the relationship between genetics and pediatric gastroenterology and nutrition? That many studies demonstrated that the hospitalization duration, the cost of the medical care and hospitalization duration is higher if there is a pediatric gastroenterology disease related to genetics. As we know all, in our countries, in Arab countries, we have high rate of consanguinity. For example, it is from 30% in both of Egypt and Syria and going to be around 60% in some other countries like in Sudan. So to produce administrative orders to limit as possible the consanguinity in case of high risky diseases related to genetics is very important in our countries. What about the colon and small intestine conditions? In fact, we know that the first disease which is related to genetics, which is proved, it is the celiac disease. We know celiac disease is prevalent in Arab countries. Some studies demonstrated that the prevalence is going from 1% to 3%. The highest level is noted in Saudi Arabia, and the lowest one was noted in Tunisia, for example. And peak ages for the diagnosis of celiac disease was noted from 1 to 3 years old and from 9 to 10 years old. We know that, for example, in USA, there is more than 3 million people with celiac disease. It is more frequent in high-risky population in Arab countries, for example, for diabetes and going from 2 to 44%. And the prevalence of celiac disease was significantly greater in children than adults. In our experience, for example, in Syria, as we see here, we detected more than 400 different cases of celiac disease from 2010. And we are increasing the number of detection of celiac disease from 30 cases per year in 2010 and 11 to be around 65 detected cases each year in 2002. The annual cost of celiac disease is very high. We know that celiac disease patients pay 2 or 4 more times for medical care. And we know that the average all costs were more than $12,000 for each patient by celiac disease, comparing with $5,000 for non-celiac disease. And we know that in addition to that, they are paying the direct cost like the food price around $1,000 per year. In addition of all of that, there is many complications with the celiac disease, which increase the risk of the high cost of celiac disease with all aspects of complications like diabetes, like failure to thrive, puberty, seizures, anemia, score retardation, osteoporosis, infertility, miscarriage, and tumors. All these aspects of complications explain why we are thinking about celiac disease with complications which complicate the life later on for the patient with the celiac disease. The second disease is the inflammatory bowel disease. We know that the incidence rate in Arab countries is around 2 per 100,000 in some studies, published studies. More than 16 studies were published in Arab countries, in, for example, Saudi Arabia, Egypt, Kuwait, United Arab Emirates, Bahrain, Lebanon, and Oman. And the mean age of the detection was 24 to 43 years old for adults and from 4 to 16 years old in pediatric age. Some studies demonstrated that there is possible relationship between genetics and the IBD in pediatric age and in adult age. Over than 3 million adults are living with IBD actually in the United States. And we know that the cost of IBD is very high. It is increasing with the time following. It was in the past $7,000 per year to be around $23 per year actually. The third disease, which is related to the genetics at the level of the small intestine and the colon, is juvenile polyposis syndrome, which is an autosomal dominant disease. The prevalence is around 1 per 100,000. The problem that this type of disease is complicated with important development of cancers, adenomas and carcinoma, around 18% of cases. Lynch syndrome, which is the hereditary non-polyposis colorectal cancer, we know that it is the most common cancer diagnosed among male in Saudi Arabia, for example, in our region. And in fact, it is influenced by some types of the genetics, and the annual cost is related to the complications and the development with the cancer later on during the life. It is going from $7,000 per year to be $40,000 per year for each patient. The fourth one is the familial adenomatous polyposis, which is considered the most commonly diagnosed cancer, and it is the second leading cause of cancer related to death worldwide. And we know it is growing, and we believe that the burden will be increased by 60% in 2030. Actually, there's more than 1,800,000 cases, and there is a high rate of the death secondary to this disease. Annual cost is very high, is around $13,000 per year. Peutz-Jeghers syndrome, which is non-cancerous polypose, as you know, and this is influenced by genetics, and the problem that there is high risk to develop later on during the life different types of cancer. Now we will move to the liver conditions and development of different diseases influenced by genetics. The first one, and the most frequent one, is the hemochromatosis. We know that the prevalence is around 1 per 300 to 500. And in fact, it is more prevalent in men than prevalent in men than women, as we know all. And it could arrive during the infancy and during the childhood between 10 to 30 years old. It is influenced directly by genetics. And the annual cost is around $3,000 per patient. And the high number explain why the cost is very high per country. What about the autoimmune hepatitis? We know that the prevalence in Arab countries is going from 2 to 17%, 2 to 17 per 100,000 children. Some studies explained that there is some relationship between genetics and this type of disease. For example, in Saudi Arabia, in a publication, the autoimmune hepatitis was considered the fourth most common cause of chronic liver disease. It is the same situation in Iran, for example, and more than 27% of all cases are accompanied with liver transplant, as well as in Egypt, for example, as we see here in this study, half of the patients developed relapses. In our country, in Syria, for example, we discovered more than 100 cases last 10 years in our clinic and the hospital. What about the polycystic liver disease? In fact, it is a genetic disease. It affects around 1 per 100,000 people. There is many possible complications and all costs related to the complications, like the hepatic cyst hemorrhage, cyst infection, and cyst ruptures. Budd-Chiari syndrome It is secondary to the high intake of contraceptive, but in some cases it is related to genetics, and it occurs in 1 per 100,000. PED-GI could be accompanied with many complications, and related to all complications, the annual cost is very high, and it is growing with the time following from 400,000 to be around 800,000 per year. What about the alpha-1 antitrypsin deficiency? In fact, it is an autosomal recessive disorder, as we know all. It affects about 1 per 1,500 to 3,500 individuals in European countries. And the replacement therapy is ready to be used, but the cost is very high by patient. It is going from 20 to 30,000 US$ per patient annually. Wilson's disease is, as we know, a genetic defect cause excessive copper accumulation in the liver or in the brain. The prevalence in Arab countries is around 1 per 30,000 live births. In Saudi Arabia, the mean age for the detection of Wilson's disease in a publication was 16 years old. A family history of Wilson disease was positive in 57% of cases, and consanguinity of parents was found in 36% of patients. The cost of the treatment is very high per patient. It is around 30,000 US$ for supply of 300 capsules per year for each patient, so it is very costly. What about the genetic pancreatitis? In fact, the genetic pancreatitis could be secondary to genetic abnormalities. And in this case, it is autosomal dominant disease. The penetrance is around 80% of cases, and the mean cost of each hospitalization for each pancreatitis is around 10,000 US$ per year. Finally, and lastly, the familial Mediterranean fever is caused by a mutation. As we know, it is an autosomal recessive disease, and the prevalence in our region is very high. For example, in a study in Turkey, it was demonstrated that the prevalence is 1 per 1,000. And we know that some types are resistant to colchicine treatment, and the high risk of development of amyloidosis later on during the life is important. And the total cost in Turkey per year, for example, it is around 30 million US$ with eye complications and 45 million US$ with complications. So as a recommendation in our presentation, we recommend necessarily to detect all types of genetic aspect of pediatric gastroenterology and nutrition. And we know that it is very important to limit as possible the consanguinity, the marriage in the same family, if there is a high risk of the genetic aspect of pediatric gastroenterology. Thank you for your listening, and I'm ready to answer all your questions. Thanks a lot.